Welcome to Menta Chiropractic. I'm Dr. Franco Menta, and I'd like to spend a few minutes with you explaining the Activator Method technique. Now, this system of analysis is designed to detect and correct spinal misalignments known as subluxations, which if left uncorrected can lead to pain, dysfunction, and eventually disease. The reason I'm down at the foot of the table is that we're starting at the feet because the feet are the foundation of the body. Just like a home has a foundation. So if the foundation is off, the rest of the structure will be off too. So as we start at the feet, the first thing we want to do is look for what we call pelvic deficiency or a short leg, which is going to indicate that there's a misalignment somewhere, either in her pelvis, in her lower extremity, or anywhere in the spine. So let's check that right now. So as I bring her feet up here, you can clearly see that that right leg is shorter than the left one, which is, again, indicating that there's something going on in the spine or lower extremity, which we're going to start doing a series of tests now to check and make adjustments to bring those legs closer to even, which will mean that her spine is back in alignment. Okay, so I'm going to get started here, and we're going to use this activator. This is a spring-loaded instrument. There's 4 different settings, and it emits a high speed but a low force thrust, putting the vertebrae or any joint in its best optimal position. So we're going to go ahead and adjust and get everything nice and even. And as you can see, as I bring her feet up, the feet are now balanced. So from the hips and pelvis down, she's completely balanced. We're now going to do additional tests to start checking her lower back and all the way up to the top of her head to determine if there's any other subluxations in the spine. Turn your head to the right. And we start to see that there is a shortening on this right leg and a lengthening on the left. So there's an indication of a subluxation present in the mid-back. So we're going to go ahead and make a couple of corrections here. And I'm going to move back down here again. And clearly you can see the correction is instantaneous. Lift your head up. Now we're in the neck, and you can see there's a more significant subluxation. And the reason that we know that is the distance between the feet are further. So the feet are the gauges. The further they are apart, the worse the subluxation is. So we're going to go ahead and we're going to correct that right now. Right there. Okay, lift your head up again. And there we go. Nice and even. Okay, so that concludes our demonstration of the Activator Method technique. I hope it was helpful in demonstrating what we do in our office and how we may be able to help you.